and today we will be demonstrating a tutorial on the process of ambulation with crutches.
All steps are to be taken seriously and not one must be skipped. Let's begin. Step 1. Make sure you have a written doctor's order for ambulation with crutches.
Even though you may think you're a great physical therapist or some other caretaker, remember people, only on doctor's orders may you give a patient crutches. Step 2. Assemble equipment, which are the following:
A robe or well-fitting clothes, non-slip, properly fitting, low-heel shoes, a gait belt, which is a device used to transfer a person from one position to another, and a pair of fully functional crutches that are properly sized for your patient.
Step 3. Wash hands in order to ensure infection control.
Step 4. Explain to the patient in simple terms the procedure before assisting them with the crutches.
Step 5. Provide privacy by closing curtains or doors if appropriate or necessary.
Step 6. If the patient is in bed, lower the bed as much as possible and lock the wheels.
Step 7. In accordance with Step 6, assist the patient to a dangling or sitting position on the side of the bed or in a chair.
Step 8. Help the patient as they put on the shoes and a robe if needed.
Step 9. Apply the gait belt if needed around the patient's waist over their clothes with a buckle in the front.
Step 10. Ensure the crutches fit properly and discuss any concerns with the right provider.
Step 11. Ensure the crutches are in tripod position. Hands should be on the hand grips to absorb the patient's weight. There shouldn't be any weight placed on the axilla, shown here in red.
Step 12. Determine the gait ordered by the patient's doctor and have the patient follow the sequence.
Step 13. Remind the patient to maintain an erect posture and keep focused on where they're ambulating to by looking straight ahead and not at their feet.
Step 14. Stay safely to the side of the patient. Watch for signs of a possible patient collapse. Don't attempt to catch a patient who begins to collapse during ambulation. Instead, slowly ease the patient to the floor using your body as an incline.
Step 15. Let the patient set the pace while keeping a firm grasp on the gait belt if used.
Step 16. Encourage the patient to achieve the ordered distance, but be observant. Watch for signs of patient fatigue. If the patient collapses, follow the steps discussed earlier.
Step 17. When ambulation is complete, help the patient return to their room or bed. Remove and put away the gait belt, robe, crutches, and shoes.
Step 18. Make sure the patient is safe and comfortable. Place the call light and personal items within easy reach.
Step 19. Wash hands again to ensure infection control.
And lastly, at step 20, communicate any specific observations, complications, or unusual responses to the appropriate provider. Also record this information in the patient's chart or EMR.
Follow these steps and you will be provided with the skills to properly assisting a patient with ambulation using crutches. I guess you can use this video as a crutch.